There is a huge burden of depression in India. It is much more than sadness or low mood. To understand the same, we spoke to Dr. Mathew Vaghese, faculty at the Department of Psychiatry, NIMHANS, clinical board member Sukoon, to understand when a person should get clinically diagnosed and what are the signs that should not be ignored.
So my first question to you is, what according to you, since you've been working in this field for so long, what according to you is the understanding of depression in India? Has it changed over the past few years?
So I think the understanding of depression has always varied. It's not just now. It's always been a doubtful or a sort of unknown kind of entity, because a lot of people talk very lightly about depression. They say, "Oh, I was depressed," or something happened and I was depressed. Now, the clinical meaning of depression is when you have clinical symptoms which affect your daily functioning. So, if you feel sad for a prolonged period of time, and usually for clinical depression, you say that you must, for a minimum period of at least 2 weeks, you should feel tired and have the other components of other symptoms of depression. So they might be sleep disturbance, having a lot of negative thoughts, having a poor appetite, losing weight, losing interest. So there is a cluster of symptoms, about 5 or 8 symptoms, which must all be present for about more than 2 weeks to say a person has got clinical depression. So when somebody says, "I was depressed," or "I was sad," "I got upset," now that might be situational and might be something that, somebody, because of some circumstances, they know something happened, and and as a result of that they feel sad or anxious or upset. Now that is not clinical depression. That is a normal part of everybody's life. You feel, you have ups and downs. You feel happy sometimes. You feel even tempered sometimes. You feel sad sometimes. Those ups and downs are part of human existence. That is not clinical depression. So when you say clinical depression, symptoms, more than 5 to 8 symptoms should have been present, including sadness or irritability, should have been present for at least 2 weeks. And usually it's more than 2 weeks. It's usually many months that the person feels like this. And invariably it affects the way the person, performs. Maybe in his job, or he loses interest in his job, or he performs, so sometimes if depression is severe, he's not able to do any of these daily activities. So he may not eat, he may not bathe, he may not look after himself. That is a severe degree. So you can have any degree from mild to moderate to severe.
My next question would be linked to what you just said. Do you see people, coming out more than before for proper diagnosis, for treatment? Are there also misdiagnoses happening in the country?
Not really. I think the number of people who we see, obviously, in a hospital, depending on the setup. If you're sitting in say a mental health clinic, you might tend to see more people who have a moderate or severe depression. While if you're sitting in a general hospital outpatient clinic, you might see people with depression who have other physical illness. So I want to mention this, that if you have a physical illness, usually a chronic physical illness like diabetes or hypertension or a heart disease, or even an infective illness like, say, tuberculosis or HIV/AIDS, or some of the other arthritis, any chronic illness, the chance of you having depression with the medical illness goes up by 3 to 5 times. So if you're sitting, depending on the setup that you're at, depending on the place that the doctor is sitting, you will see more or less of the depression because of the number of cases. If you look at figures in the general population, say there are a couple of studies that have been done recently. 2016, I was involved with the National Mental Health Survey. There, the figures of just depression alone was about on an average about 5%. So about 5% of the population might have depression at some point of time.
Right.
But if you go to a general hospital, the rates of people having depression might go up anything from 20 to 50%, depending on the kind of situation that you are in.
Have you seen an increase in number post-pandemic?
Not really. I have not really seen an increase in number because of the pandemic. But because of the pandemic, people might have had short-lasting periods of anxiety or depression, and many of them may not come for help because, as I mentioned, if they have depression or anxiety which is present for short periods of time, they don't qualify for clinical depression and they will not come for any kind of help.
Right.
Now, one of the things that has happened because of the pandemic, and that is something that we see, is that people who had a pre-existing illness, like say depression or anxiety or psychosis or anything else, it was difficult, at least the last first 2 or 3 years, to come for help to the hospital because everybody was dealing with COVID-19. And so people couldn't access services, they couldn't go to their doctors for follow-up, or they were too scared to go for any kind of help. So all physical illness and mental illnesses got a kind of, went into the background because of this overwhelming need to look after COVID-19. So that is something that has happened. And we have seen post, the pandemic, when people have started coming back to hospitals, we have seen people who, as a result of not having treatment, they might have had a relapse or they might have had a tougher time because they have not been on treatment, or they were in irregular treatment.
Another thing that I keep hearing from people, I'm not talking about the, chronically ill patients who end up getting clinically diagnosed, but about people who've had other life-altering experiences, having lost someone in the family, low grades, depression. So, a lot of people just give that sort of an advice, work out, eat healthy, do things, follow a hobby, etc. All of this will treat your depression. You don't have to go to a therapist. What do you have to say about that?
So, I want to distinguish between depression or mood which happen on a day-to-day basis from bereavement. Now, bereavement is a normal part of human existence. If you lost somebody, especially lost somebody in the pandemic, suddenly lost somebody, you couldn't be with the person, he or she was in the ICU, and then you've lost somebody, or there's a big loss in your family or finance or something. That can cause an adjustment problem, which is like a bereavement. Now, bereavement is not really a psychiatric disorder, because that is something that all of us face. When we lose our parents or we lose our young ones, there is something that we face. So it's not that in that sense a psychiatric disorder. But it becomes a psychiatric disorder if the bereavement lasts for too long. So if somebody usually bereavement might last anything from say 3 months, 4 months, and usually you learn to cope with things and get on with life maybe after 6 months. But if it persists, if it's prolonged, then it's going on for more than 6 months, then you would call it a pathological or abnormal bereavement, in which case they might come to a psychiatric, notice. Now, bereavement and loss of, life events which are negative, are all risk factors for depression. So, if you lost somebody, if you got an illness, you've gone through a divorce, or you've gone through a separation, or you have changed, you've sort of migrated, you've changed, in your life situation, maybe your jobs or your interpersonal relationships. Now, these can all be, they're negative events, they can all be precipitants for a depressive episode. So that is something that could happen. But if you depression that you ask, are we seeing more cases of depression? Not really. Because we would see the same number of cases. I would say it is not sort of phenomenally increased like people are talking about.
So before we end this conversation, I want to ask: we've been hearing about a dearth of mental health care professionals. What is it that you feel that people, caregivers, family, friends can do to really address this situation, to ensure that people get help?
So before I answer that question, let me tell you about two other studies that are there. One is called the Longitudinal Aging Study of India. This is a study of people post 45 who are going to be followed up every 3-4 years, and it's going to be done onwards for the next 20 years or so. Now that is a study of people of 45 plus, and that's a study looking at elders. Now, if you look at elders, the prevalence of depression is a little more. I told you it's about 5% of the general population, which includes adults, young adults. But if you look at elders, the percentage of people who have depression is probably a little higher, maybe about 7%. So that is a study called the Longitudinal Aging Study. There is another study which is now going on, which is the National Mental Health Survey, Part 2, which is basically now in the field in the big cities, the mega cities. So cities of Delhi, Mumbai, Calcutta, Hyderabad, Chennai, Bangalore. The survey is now actually going on. It is conducted by NIMHANS. And the survey is looking at all mental disorders in the big cities, the mega cities. So when the results come out, maybe end of this year or later, you will really see whether, as a result of COVID, has mental disorders, depression, has it gone up or not. That will really see in a proper study whether that's really happened. We can all speculate and have conjectures whether it's gone up or not gone up, but we really see the data towards the end of the year.
Yeah, it would be interesting to know.
The question that you asked about what can people do? Yes, definitely there's a dearth of mental health professionals. The ratio of mental health professionals to population is definitely lower than what the WHO wants us to have. So definitely it's low. And the other thing is that people don't access services because there is a stigma. People don't want to say they got depression or they got some mental disorder and go and take treatment. Those stigmas are getting better, but there's still difficulty with access. But there's lots of things that you can do yourself. Now, the biggest thing is self-care. Now, self-care is something that is supposed to help for all of us. And you don't need to, for self-care, you don't need to go to a doctor. For example, during COVID, the best evidence that self-care works is what you saw during COVID because everybody got educated. Everybody was masking and keeping distance and being careful and washing their hands and doing so many things. That is self-care. So for depression, there are things that you can do. If you follow a regular routine schedule, if you do exercise, aerobic exercise and yoga is definitely known to help with preventing depression. If you talk to people about your problems, if you talk to your friends, family, colleagues about difficulties that you're having, talking about your problems, talking about your feelings, talking about depression is definitely something that will help. And the other thing that will help is if you can't get relief by doing all these things, there are a lot of lay counselors and people who are qualified who you can go to. If it's difficult for you to go to a mental health professional because of stigma, start at least with your inner circle of friends and family, and then start with exercise, start with a regular routine, and then if you're still not being helped, go to a counselor. And there are many online counseling services or in-person counseling services that are sprung up all over the country. That is the next step. But if it's something more serious, usually counselors will then refer you, the person who's suffering, to a mental health professional, or a trained mental health professional in a hospital or a clinic or wherever.
Okay. Thank you so much for your time, Dr. Vaghese, and I hope that this helps spread awareness and bridge the gap, much needed gap.
Thank you very much.